Now, the government black box. Here's another. Why? We see something every day that makes us know that it's a black box. We don't understand it. But they're going to shut down on April 8th. That's what the news is today, as of about 4 hours ago. And Obama will be out of town. So that means he's probably not actually having anything to do with that. And Congress and the White House don't agree on the spending. And they're trying to figure out, is it going to be to the advantage of the Democrats or the Republicans if it shuts down? They're looking at whose political advantage it is in 2012 if you put everybody out of work on Monday morning. And I say everybody out of work. You put the government employees out of work, there's a lot of people that are not going to get a check beyond them. Is the post office going to deliver mail if they shut down? I want to mail all the checks I owe to people today. That's what I want to do. Right? Some federal employees, though, might be eligible based on state laws and rules for state unemployment if they lay them off on Monday. And they can't claim any vacation time, and they can't claim any leave, paid leave. It's unpaid furlough Monday. All right. The revolution will not be televised. You know that song. All right. And we will return to our ticky-tacky boxes. And that's me. I'm going to go home and get in my little red house, and he's going to go to his greenhouse in the suburbs of Houston, and we're going to hold our hands over our ears like this and shut our eyes and not do anything. Or we're going to get up and do something. And that's what we're here to try to start. Now, machines and technology. I told you about the proton accelerator and how much it costs and what the procedure cost, but there's an alternative in all of this technology. There are things that people know about care and treatment that have nothing to do with being high-tech and address the same problems and cure the same kinds of issues and same kinds of difficulties. And I'll give you two examples. This is one I know of because there was a doctor in Georgia in Russia who 40 years ago invented a medication. He's a dermatologist, and he invented a medication to treat tumors, and it was selenium-based, and he took selenium, an element, and he put it in water, and he put an electrical charge on it, and it became a colloidal suspension in the water, very stable, very long shelf life. We don't even know it's years. It's not months or anything. And he takes a capillary tube, and he puts a little of this stuff in a capillary tube, and he puts it on a lesion, skin lesion, and it kills the skin lesion because the abnormal cell is apparently more porous than the normal cell, and so it takes up the selenium. The selenium freezes the mitochondria. The cell dies, actually smothers to death, I guess, and then the immune system of the body rushes in and kills it, but it doesn't destroy any of the normal tissue around that cell. So it doesn't leave the scar. Sometimes it leaves a scar, but most of the time it doesn't. And it treats both benign and malignant tumors and melanomas and cervical cancer. And as of last month, they started treating brain tumors in Russia with it. All right. It isn't allowed in the United States. It's not licensed here yet. It hasn't even been applied for. It has 91 different applications, and the estimation is it costs $100 million for every application to get it approved by the FDA of the United States. It is approved in Russia, Israel, Switzerland, and it's approved in, it's been through clinical trials in Mexico and will probably be in Latin America this next year. The next picture, I'll show you an example of what this medicine does. This is a woman, this is benign lesions, by the way, they're not malignant. But about the picture on the right is about 2 seconds after the application of the selenium, and it turns the lesion white because it's killed it right then. All right. Then a couple of days later, a day later, it turns black because it's dead. It's just dead tissue like a scab. And then in about a week, it falls off, and she looks like that. All right. Now we have thousands of examples in the clinical trials in Mexico. They did last year. They did a little over 600 cases, and they had 98% positive results, no side effects. 2% it didn't work on. 2% of the people didn't work on. but 98% perfectly effective. They don't have any drugs, I think, that have ever been approved in the United States that ever had that kind of trial. I don't think there's ever been one. And this is not going to be available. The revolution will not be televised. It's not going to be available in the United States. But you can go to Mexico and probably the rest of Latin America and to Europe and get it done. The difference in cost, this cost $100, $250 maybe. The other one costs $50,000. All right. So, where we are now is I have ruined you, I suppose, on medicine, insurance, technology, and government. Now, having been ruined in those 4 areas, we want to bring you, as Barack promised us, hope. He promised us hope, so maybe we can find hope in among ourselves in dealing with this. What we thought we could do, and we think we still can do, is to have all of the people in the community say, yes, we want to solve at least health care as a cooperative. Then to approach the doctors at the same time and say, will you join with us and do that? We'll join hands and we'll support you. Now, one of the things we discovered in testing this to find out what the economics of it, because we had no idea what the real cost was of doing a cooperative. We didn't know how much people would pay and whether what they paid would be enough to support a physician, and what level of income people would have to participate, whether they would have to have government subsidies or what was going on. So in our interviewing of the 4,000 patients that we did to find out what their level of awareness was and what their capabilities were, we discovered they consistently answered that they could pay $25 to $30 a month for primary health care. And so we had to say, well, what does that mean? What is $25 to $30 a month? How much does that mean to a doctor that's doing primary health care? So I said, well, let's look at some of the statements and some of the financial reports from our physicians to see how much money they make and how many patients they're seeing, because that's all it is. How much money did you earn last year and how many patients, unique patients, did you see? Well, it turns out that it varies a little bit, but general practices in Houston, Texas averaged $440,000 a year gross, and they saw 2,000 patients. So how much was that? Anybody want to do the math in their head real fast? 2,000 divided into $440,000 is $200, a little under $20 a month, right? Right? A little under $20 a month. So when the patients that we asked to come in off the street and didn't ask them to pay for anything and told them it was a free clinic, when they came to our clinic and told us they could pay $25, these were people that didn't have any money or didn't say they have any money and normally wouldn't go to a free clinic if they had any other options. All right? They could pay $25. They could pay doctors $5 more than doctors make playing all the games in the world, playing with all the insurance companies, taking all the government contracts, taking all the HMO contracts. They could collect from a street vendor or from somebody with a sign begging on the corner more money than they can make in the normal system. So I said, well, this is a go. If you can make more money collecting it from people who are unemployed and are begging in the street than you can begging the insurance company, why wouldn't you do it? And so what happened is when we found that out and then we started checking with the doctors, this year we got 50 doctors to sign on. Yeah, we'll do that. You know why? It's more money than they get normally, and they're not filing any claims with an insurance company, and it's all confidential. We're not having to check your name, your address, your background, or anything. The exchange is straight up and private and personal and confidential. Any medical records issues at all, because it's only between the doctor and that patient. So he said, this is easy. He said, well, what problems are we going to run into if it's that easy. What's going to happen to us if it can't be that easy? And then I told Sam Bowen about it. And Sam Bowen's a doctor who has a clinic that's an urgent care clinic in Hickory, North Carolina. I said, look how easy this is, Sam. And Sam, I don't know, I'll go try that. So Sam went back to his clinic and started enrolling patients. He now has about 600 patients enrolled this year. Well, it's about 1 year now. 600 patients in a year enrolled in his clinic. And pay him that $30 is what he's charging them. $30. And they're all enormously happy. Wonderfully happy about what they're doing. And then my daughter, who's an acupuncturist and an Eastern medicine doctor, and is getting her, or will be this coming year, she'll take her boards this next year, but she and her colleagues who she's going to school with over there have decided, golly, this is applicable to Eastern medicine. We should do this. We should do this because it was a Chinese idea to begin with. The Chinese thought this up, so if they're going to give us the medicine and the mode of treatment and everything, we at least ought to take some economic advice from them and go ahead and make a plan, a payment plan with our patients, and quit worrying about all of whether we're included in Medicare and whether we're included in insurance plans or not. Just a payment plan. And become their primary care provider. And when we find something we can't do, we'll refer them to somebody we think knows something more than we do. So that's what, so my daughter is now organizing for her practice. It's going to start next year. She's setting up that so she can enroll a group of patients and they'll be ready to use her when she gets out next year. And so her classmates who've come over and talked about the same thing.